I'm doing great. Super excited to be here. Thank you.
Yeah. So, Dr. Rhew, when I think of Microsoft's work in healthcare, I think almost exclusively about the work you guys do bringing healthcare companies onto your cloud. But I wanted to hear it from you. What is it that you actually do? Walk us through a little bit of your role.
Well, if you think about really the opportunity for technology, it's to help organizations and individuals be able to achieve more than what they can currently do. And what we oftentimes find is that there's more than just one piece that is essential. So what we've been focusing on is how can we help organizations by leveraging cloud technology, artificial intelligence, care collaboration tools, and a variety of other things, make them work seamlessly, interoperably within the technologies that Microsoft provides, but also allow us to be able to integrate that into clinical workflows, patient lifestyle, and allow us to be able to have a more seamless experience. And that is how we look to enhance the experience for patients, providers, and ultimately improve outcomes.
Yeah, and you just joined about 2 years ago. I guess coming into the role, what were some misconceptions that you, or surprises that you kind of found as you started to get into the work you were doing at Microsoft?
Well, one of the things is I joined about a year before the pandemic, and I think in large part, every organization has a strategy of how they're going to apply the technologies and really transform the experience for the individuals that they serve. Well, when the pandemic hit, I think what we realized was that we had to focus on areas that were of greatest concern, providing information to patients and consumers on whether or not they actually even had the infection. And that was something that was extraordinary because we had technology already built that could be customized and allow us to be able to provide that right information at the right time for consumers using an AI-based chatbot. Mm-hmm. And this is something that we tested with Providence Health System, and we found it worked very, very well. This then became really a cornerstone of the overall approach to how organizations across the globe began providing information to these individuals who in many cases just needed to know right then, do I need to go to the emergency department? Do I need to go to the urgent care? Or can I stay at home? And I think that was something that we saw the after effect being that we were able to decrease the amount of call volume and also foot traffic into urgent care centers. And it really helped in the initial stage of the pandemic management.
For that AI chatbot, what was the use before the pandemic? What was the initial intent of that project?
Well, I think most of us have probably had experiences with AI-based chatbots on the internet or even on a mobile device. But oftentimes what we find is when there's high volume and there's consistency with responses, we can automate it. There's a great opportunity for us to be able to make things more seamless, but also the transitions were something were really interesting. So it wasn't just about providing the right information, but we could, because we knew the context of why an individual or where they were at, we could transition them to a virtual care visit, mm-hmm. or perhaps identify that this was a person that was eligible for a clinical trial, or perhaps a program that we could offer. And that's now given us a brand new insight to apply AI-based consumer-facing tools or patient-facing tools to connect them with programs and other types of opportunities that we oftentimes find are not possible, when we rely purely on encounters.
Yeah, and just to get back to my initial impression, so it's not just all trying to sell the cloud to different healthcare providers?
I think in general, what we found was that by trying to address the needs of the customer, the needs of society, there's always a technology role. And the technology is something that is in the background. The data that's captured has to be secure. It has to be made more interoperable. It has to be integrated into clinical workflows. And a lot of that plumbing is something that Microsoft does very well.
Yeah, that's really interesting that you use the word plumbing, because it's one I think about a lot. I feel like at this conference we've heard a lot about a lot of companies, a lot of startups and younger kind of not massive companies like Microsoft talking about how they're trying to make the experience for clinicians, for patients, for all the different stakeholders in healthcare a much more seamless experience, similar to the word you used. But I guess I'm curious if you alone as Microsoft can do that, or do you see a role for partners? Like, I guess I'm thinking of the companies that make claims and billing technology easier, the companies that make EMR software a lot more, like sit on top of it and kind of aggregate that data.
Well, that's a really essential part of our approach.
Okay.
Finding ways that we can work with partners, build an ecosystem that startups, middle-sized, large companies can take advantage of. I mean, if you just think about some of the more recent announcements, Microsoft working with Truveta. Truveta, for those that aren't as familiar, a collaboration between some of the largest health systems and healthcare organizations across the country, representing about 15% of all patient encounters. The clinical data, the genomic data, the imaging data, all being brought together in a de-identified manner to be able to help provide insights and ultimately save lives. And that's something that we've been focusing on through some large-scale partnerships. But then we also work at individual levels and trying to work with organizations that want to do research in the area. So during the pandemic, Microsoft, through our AI for Health initiative, started working closely with organizations that wanted to research new strategies on how COVID could be better diagnosed and treated. And that's an opportunity as well where cloud computing and AI could be used. And ultimately, we want to see if there's ways that we can help.
Walk me through that a little bit more. When you say help, like, how do you see your role? Like, if we were sitting at a table and everyone was dividing up this group project, like, what role would Microsoft play?
I think one of the first things is we would want the individuals and the organizations that have unique value and create a business or some kind of an opportunity for them to be able to define their role. And then in the process, they oftentimes find that they need to connect that data to a system that's secure, made more interoperable, perhaps leverage AI-based tools that would be very difficult for them to build themselves. And in that scenario, that's where we can really come in and help, because there's no point in reinventing the wheel when organizations are investing a significant amount of time and resources to make tools more accessible through open APIs and a platform that is interoperable. And that's really what Microsoft has tried to focus on: interoperability, security, and the ability for us to be able to help our partners as well as our customers.
Yeah, so you're fine with this kind of supporting role? You're not seeing yourself being competitive to, I guess, the Truvetas of the world? That'd be a little funky.
No, we're absolutely in a supportive role, just trying to find ways that we can help. And part of it is just based on the business model. It used to be that Microsoft was a very technology-first company. Our mission was putting a computer on every desktop. Well, that changed 7 years ago. It's now about empowering individuals and organizations to be able to accomplish their goals and to be able to achieve and think of things that they couldn't even do with technology. And as part of that initiative, we have been working closely with organizations that have a significant amount of data, and it's their data. We need to make sure that we can protect it, but our business model is not around data monetization. It's really about just helping to enable that data to become much more useful.
Yeah, for sure. And I want to drill in on this a little bit more, because I think as someone who covers the space, I think a lot about the ways tech is trying to influence healthcare, and there's a lot of, the very old buzzword of disruption kind of comes up quite a lot. And one thing I think about a lot is a lot of the folks who are in tech, so your rivals, but not you guys, are taking a different approach, which is going head to head with existing incumbents in the healthcare industry. But you guys are taking more of the partnership approach. And I guess I'm curious if you see that as, having less of a chance to be disruptive.
Yeah, I guess I don't really look at it from the perspective of trying to disrupt industry, but more in the context of how can we help organizations that are trying to achieve their goals. And in many cases, that has been something that we've been doing for years. We have the infrastructure in place. We have a lot of the tools that are relevant from a clinical workflow perspective. If you think about Microsoft Office, for instance, almost every organization across the globe has Office. We've extended that capability with Teams. We've made that more HIPAA compliant and able to integrate with EHRs. In fact, just today we announced the integration with the Cerner EHR, so you can launch directly from a Cerner EHR application into a Teams environment. These are the types of ways that we are finding that our approach is valuable for a large number of organizations.
Yeah, and I want to hear a little bit more about that, especially like the Teams element and thinking about these tools that can be for consumers or for business professionals, but also for a healthcare setting. Tell us a little bit about the evidence that you're seeing that this is actually being useful for clinicians at the bedside or the folks who actually want using them in a healthcare setting.
Well, one of the big challenges we see in healthcare today is clinician burnout. And ultimately, a large part of that is the fact that it's not just about seeing the patient, but it's about documenting that encounter into the electronic health record. Well, working with one of our partners, Nuance, we had been building the technologies that allowed us to be able to convert from voice to text, understand the context of that text, and then create a progress note from there, and then integrate that into the medical record. Now, that process was something that we had been testing in many organizations, and we saw that we were able to reduce the amount of time needed to document by about 50%, sometimes even greater. Now, that we also saw this had a dramatic impact on clinician satisfaction as well, because, hey, less time documenting and more time seeing patients or doing whatever you can with that is something that was a huge satisfier. And so what we found was that this AI-based technology, voice-based, natural language processing, can have a huge impact on healthcare, and ultimately is something that we launched as a product during the pandemic, and we're super excited to see where it goes from here.
Yeah, and it's great that you're gathering data points on this kind of stuff. Like 50% probably translates into a lot of different, data points of like more time spent doing things unrelated to your job and things like that. So I'm going to be curious to hear some more data points coming out of you guys in the future. But just to shift to the pandemic, because I think I was reading through a blog post I think you guys are just putting out right now, and it was describing a lot of the different ways you guys kind of pivoted during the pandemic. We talked about the chatbot a little bit, but I guess I'm curious, how drastically did your strategy have to change as a result of this massive global interruption?
Well, I think everyone recognizes that the acceleration of digital from maybe 2 years of digital timelines to around 2 months was something that allowed us to be able to take full advantage of virtual care technologies. So that was something that clearly was an area that we started spending more time on, and everything from enabling teams for telehealth, partnering with organizations like Teladoc to be able to provide comprehensive services, Mobile Heartbeat, a variety of other organizations that we have been focusing on around the virtual care aspect. But one of the other things that we saw was that in the process of delivering technology virtually and really trying to provide as much value to organizations and individuals, it created some other challenges. And one of those was around the digital divide. So to address health disparities, we have been spending a lot of time trying to create a balanced approach. This can be dated back to 4 years ago when Microsoft started with the Airband approach, or Airband initiative, that allowed us to be able to work with organizations and provide affordable broadband to not just rural areas, but places across the globe. And in fact, back to the numbers, we have over 1.4 million individuals that we've been able to successfully provide affordable broadband through these partnerships in the US, and over 14 million globally. And that has been sort of one of the starting points where we recognize that people need internet. They need to be able to tap into these resources. And then the next stage is around digital reskilling, which is an area that we spent a significant amount of time trying to help provide this level of training. And then more recently, it has been focused a significant amount on public-private partnerships. And how can we work in the context of these public-private partnerships to deliver essential health services, including COVID vaccinations, to the underserved and vulnerable. And that's been an area where that also requires a technology back end to be able to ensure that this is done securely and in a way that allows us to integrate that data with existing health records.
Yeah, that's really interesting. Tell me a little bit more about that public-private partnership around vaccines. How did that kind of play out?
Well, it started with the fact that Microsoft began rolling out during the pandemic technologies that supported large-scale vaccination. So if any of you have been to the mass vaccination sites, in different states or even in different countries, a large part of that was not something that an EHR could handle.
Sure.
So that was something that we built first as a technology, and then as a product. We launched that during the pandemic, and then ultimately that transitioned as organizations across the country and the globe started moving towards more of a pop-up mobile type of vaccination. Well, very soon there was a very interesting paradigm where we actually had more vaccine available than people that wanted it. And this whole issue of vaccine hesitancy came about. And the reasons why were because we needed to combine that with a conversation about the vaccine by trusted individuals. Now, those trusted individuals are oftentimes physicians or clinicians, but they're also people in the community. And that's when we recognized that we had to bring those folks and empower them with the tools and the resources to be able to have those conversations, but do it in the context of these events. And we started these events in Washington. We had great success there. We started moving then in California, specifically in the Central Valley, where a large number of migrant workers were, and then moved to Georgia, and more recently in Mississippi, and we're now looking to expand that more broadly, globally. And it really stems from the fact that we had communities that knew what they wanted to do. They needed to be connected to the healthcare systems, but there needed to be a technology that supported that integration. And so that's where this coalition of public-private partners have gotten together, and we've been driving it centrally managed, but locally driven.
Interesting. So maybe someday you can help us get away from the physical paper vaccine cards and into something a little bit more, that's probably not quite the domain that you're talking about. You're probably talking more back end than that.
Well, you know, it all ties together, everything from the vaccination to being able to show that you have been vaccinated.
Yeah.
And then additionally, what we found was that this was an opportunity to provide essential health services, things that were missed during the pandemic, everything from blood pressure screening to vaccinations for kids to adults, and a variety of other things to plug them into the health system by enrolling them into insurance and addressing some of those social determinants. And again, a lot of this was done in the context of these public-private partnerships.
Yeah. So just to get back a little bit to your role and kind of what keeps you busy when you're not at a conference for a couple of days, what's the one project that you're obsessed with right now, or the one problem that you're trying to sort through that like keeps you up at night and you're obsessing over?
Well, I spend, I'd say, a good part of my time thinking about the pandemic and largely about how we can address some of the needs of deploying these technologies into underserved areas to help in the process of delivering health services. But I also spend a significant amount of my time thinking about the existing infrastructure that we have today. And a large part of that is something that could be greatly enhanced through data platforms that are interoperable, safe, and a big focus is on how do we apply data standards such as FHIR and build tools that allow us to be able to provide greater opportunities for a connection between EHRs and other systems. So for me, it's about that infrastructure, but then what gets me really excited is the artificial intelligence that can be applied on top of it.
Sure.
A lot of, when we think of AI, we oftentimes think of advanced analytics and algorithms. But really, it's about also looking at unstructured data, voice to text, voice AI, text analytics. There's so much information in unstructured formats, the medical literature and progress notes. If we can tap into that and apply some of the text analytics on top of that, we can expand our knowledge and understanding of the individuals. And then from there, let's apply visual analytics on different things that we have, whether they're images, and other types of data that's captured. That gives us great insights, and then it has to be coordinated and collaborated. And so how that then gets integrated into collaboration tools. So how do you orchestrate all of this? All this information, the technology, it really is something that's exciting. And I think through our partnerships, we've been able to figure out some really great use cases.
Got it. It's a lot to think about on top of the pandemic. Yeah, the infrastructure piece is one that I still have a hard time wrapping my head around how big of a project that's going to be truly interoperable. And we're almost out of time, so I think we can get this in really briefly. So say we're at health in 5-10 years. What will I be up here assuming about Microsoft by then? That is, what is Microsoft going to be known for in healthcare in the next couple of years?
Well, I think, as we talked about before, we're really all about the partnerships. Hopefully, our partners will be talking about some of the great work that they've done with the help of Microsoft. And I think the artificial intelligence that we have been building, the things that you hear about with regards to natural language processing, clearly the ability for us to capture new sources of information that are unstructured, whether they be voice or other types of mechanisms, we have an opportunity to be able to start making sense of all that and then provide the right information at the right time to not only clinicians, but also patients. And to be able to then talk about how, in the end, that we were able to save lives and improve healthcare. That's what I'd love to see and expect to see.
Cool. We'll be out here with your partner next time.
Thank you.
You'll just be in the background. I'm just kidding. But thank you so much, Dr. Rhew, for taking the time to talk.
It's wonderful. Thank you very much.
Thank you all for being here.